I'm Dr. Ryan Wakim, board-certified psychiatrist and founder of Clinical CBD, as a key opinion leader nationally regarding treatment-resistant psychologic and psychiatric cases. We set out to develop something that was beyond your standard over-the-counter hemp oil or CBD product. As an offshoot of medical marijuana, they ended up figuring out that the entire cannabis plant had several pieces to it that could potentially be helpful in a number of different ailments. They've looked at whole plant metrics for chronic pain conditions. Obviously, there's medical marijuana itself that tends to be higher in what's called THC, which is the psychoactive agent of a cannabis plant. And then finally, we started to look at the different cannabinoids in terms of CBD, CBN, CBG, CBC. The different variety of cannabinoids thereby can oftentimes treat some of the other more mental health related conditions. CBD initially got studied in the medical community as something that could be helpful for retractable seizures. So we knew that it actually reduced or calmed neuronal activity, which also tends to be an issue in panic disorders, obsessions, and generalized anxiety disorders. CBD comes in a number of different routes of administration, so to speak. You can get CBD in gummies, you can get CBD as tinctures, you can get CBD as salves or balms or lotions, and you can get CBD in a capsule form as well. Finally, as we look at different routes of administration, the capsule tablet formulation of CBD as mirroring more traditional psychopharmacologic agents or traditional drugs will likely be one of the more common versions of CBD into the future. Currently, CBD is fairly ubiquitous. You can search it on Amazon under hemp oil. You can Google it, obviously. The problem we've run into with that very issue is you don't know what you're getting. The FDA doesn't regulate CBD, the DEA doesn't regulate CBD right now. And for that reason, when you actually get third-party labs to test these products, you often don't find in it what it is, it's being touted available and in it. So when we were setting out to develop a kind of non-traditional treatment option, specifically in the realm of cannabinoids and CBD, we wanted to ensure we were using a laboratory that was FDA approved and one that really held the same standards and levels of excellence that you get from any prescription from any doctor. So when we set out to disrupt the space and actually create a clinical component to something that isn't FDA regulated, we saw the main opportunity there, or the main void of what's currently there, being the simple fact that there is no structure or certainty or oversight over this product. As I said, you can Google it, you can go on Amazon and buy it. There's certainly some validity issues about what you're getting when you do that. But the other thing we know is when you take something that isn't prescribed to you or recommended to you, or somewhere in between and not know. So we really wanted to provide that certainty. We really wanted to provide that structure. We wanted to provide the clinical supervision and medical expertise to a product that's not currently regulated by the FDA to create better outcomes and to provide better care for our patients. Specifically those who struggle with some of these more treatment-resistant issues like chronic anxiety, like chronic insomnia, where when you don't add structure to it, it can just snowball and actually potentially create a worse situation for someone. All that being said, beyond the product itself, we wanted to also create clinical structure supervision for anyone taking CBD, even if it's not a Clinical CBD branded product. A lot of people still just need that certainty or structure, or just want that clinical supervision as to how best to take it, when you should take it, how much you should take, what version you should take, because there's a lot there medically that a lot of people can't decipher on their own, or at least not reliably. As it stands right now, any CBD form, hemp oil, even clinical CBD is still not regulated by the FDA. So therefore, there's no such thing as a need for a prescription for this. Again, our whole goal right now is to begin providing that clinical experience and supervision and recommendations, knowing that or understanding that eventually the FDA will likely take this over, and being able to provide that now, not 5 years from now, can help a lot of people in the meantime. Clinical CBD or CBD products themselves don't traditionally affect someone's mood, other than to help regulate neuronal activity and potentially calm areas of overactivity, which tend to be responsible for things like obsessions, compulsions, panic attacks, and generalized anxiety, or worries and issues both initiating and maintaining sleep. So traditionally we talk about mood, we tend to talk about mood in the setting of depression. And to this point, there's been no evidence to suggest that CBD would negatively impact someone's mood or make them more depressed. In fact, there is some evidence on a offshoot of CBD called CBC, which may actually help to boost or improve someone's mood, and presently working on potential formulations down that road as well. One of the things we set out to do with a clinical CBD product is to be able to tackle that chronic insomnia case, where we've tried a number of other traditional drug or pharmacologic agents and gotten very little, if any, response. And so when we look at insomnia, again, that tends to relate to anxiety, worries, nerves, waking up frequently through the night with nervousness or anxiety. And so when we look at the electrical activity of the brain, oftentimes someone with chronic insomnia could benefit from a more calming supplement like a clinical CBD to help reduce the overactivity in the areas that might be driving those worries or driving the issue, both falling and or staying asleep. The other key area we looked at with a clinical CBD product in terms of something that tends to be pretty treatment resistant and oftentimes either doesn't respond well to medication or can come with a lot of side effects with those medications is chronic anxiety and panic. And so as we mentioned earlier, knowing that CBD can calm neurons and treat intractable seizures, from a pharmacologic or a physiologic perspective, we're able to extrapolate that information out and show that using this in someone with chronic anxiety may also calm those neurons and reduce some of that day-to-day physical or psychological stress that someone feels as it pertains to a panic disorder or an anxiety disorder. CBD is being fairly new to the medical community, still not being overseen by the FDA, is often perplexing to providers. If you haven't trained recently, or you're not someone who tends to be an early adopter or fairly progressive and go seek something out on your own to educate yourself, the idea of even medical marijuana, let alone clinical CBD, can again be fairly perplexing. So one of the things we've also set out to do in terms of helping, with the whole purpose of helping patients and improve outcomes for people, is to help educate and provide support for the provider base as well. Because one thing we know is if you're a provider and you don't feel comfortable with a drug or a treatment option, you're not likely to recommend it to your patient base, even if it may be just as good, if not better, than some of the other options you may be more comfortable with. And that's not anyone's fault. It just comes down to the fact that as being fairly new and not being taught in medical school and not really being taught in residency, unless you're a self-motivated self-learner, you probably haven't educated yourself or haven't been exposed much as to what to use in terms of a CBD product. And that's another area that we really want to focus on as we move into the future with a clinical CBD product. As taking a look at clinical CBD as a product and the structure and supervision around that we're attempting to create, we do understand that, again, it is fairly new to a lot of providers, and if you as a patient go to a provider and ask questions about CBD, they may have a fairly negative connotation around that just because all they know is what they read or see on Amazon or Google. So one of the most important things you can do when asking questions about CBD to your provider is to gauge how much they seem to understand about it, but also let them know that there are now clinical-based products and they can always reach out for more assistance if they need some help educating themselves or finding resources as to where CBD might fit into their practice.